these blood vessels that are coming in here? I mean, what are these? I mean, do they have them here? They have one here. They have some vessels here. So let's talk about this. Let's kind of try to follow the pathway. This blood vessel coming in here branches, and it looks like it goes into, does it go into the capillaries? I guess it does. Okay, and this vessel here looks like it's coming out of the, does it come out of the capillaries and leaves? And I have to be honest with you. The back probably is a little better, where you can see it going into the capillaries and out of the capillaries. If these blood vessels are supplying the capillaries that cover the outside of the alveoli, what vessels do you think that these are?
Arterioles?
No, I mean, what the name of the vessels? What would the name of these be? Are these coming,
Pulmonary.
is this part of the pulmonary? Between heart and lung? Or are these blood vessels part of, it's kind of like the coronary circulation, part of the vessels that supply the living tissue of the lung?
Pulmonary.
These are part of the pulmonary circuit, right? So this one, is this bringing the blood into the lung or out of the lung?
Into.
Into. Deoxygenated goes in. It goes away from the heart. This would be the pulmonary artery. It brings it, and you see it better here, it brings it to each alveolus. It gets oxygenated, and it comes out back to the heart, pulmonary vein.
Don't your lungs still need a blood supply though?
Yeah.
What is that?
Well, it's kind of on here, these things that are drawn, but these are the two main ones. And I just want to represent what those were. But you see some stuff drawn on the side here, and you see a branch coming off in a lighter orange and a dark red, lighter orange. That's part of the system that supplies the living cells. Okay, and those are little branches coming down.
What about those elastic fibers? Don't they need nutrients to repair themselves?
Yeah, but those are maintained by the cells. The cells take care of them. Okay, so pulmonary artery, pulmonary vein.
And where do they go to again?
Back and forth to the heart. And the question was, where's the vessels that supply the living tissue of the lung? You're going to have to look closely, but when you look on the back, and that's really probably the best place to see it, you're going to notice that there's dark red, and there's a kind of an orangey red, side by side. The dark red represents the super oxygenated blood that's going back to the heart. The orangey red represents the blood that's coming to the lung from the heart to perfuse the living tissue. They're side by side here. It's a small distinction, but it is a distinction.
It's like a bronchial artery.
Bronchial arteries and veins. It would be the bronchial artery and red bronchial veins are the ones that supply the living lung tissue. So what do we see on here? We see bronchial artery here in orange, and if we have to make something up, bronchial veins here painted on one of the septum, one of the walls that break up the compartments. Pulmonary artery, pulmonary vein. Here, bronchial artery, bronchial vein are smaller ones interspersed.